Ladies and gentlemen, welcome back. My name is Mark Drax. I'm on the board of SASH, and this is another conversation from the couch. And today I have the joy of talking to Dr. Mateusz Gola, who is going to be speaking at our conference in October. Dr. Gola, a warm welcome to you.
Welcome everyone, and it's a great pleasure to be here. Thanks for having me at SASH, and thanks for having me here at the couch.
Thank you. I know, on the metaphorical couch, despite the fact we're 8,000 miles apart.
That's true. That's true. We are in different parts of the world, but
absolutely,
with new technologies, everything is possible these days.
Got to work with what we've got, right?
Exactly.
Mateusz, I've got a few questions to ask you. You're very kindly going to be talking to another of my fellow board members, Dr. Kraus, at our upcoming conference in October, and you're going to be on a panel talking about. And what I'd love to do is say, could you hand over to you if you tell us about the topic and that you're going to be sharing with Dr. Kraus.
Yes, so on this panel, we will be talking about compulsive sexual behavior disorders, this new entity recognized by World Health Organization recently as a disorder, and specifically about problematic pornography use. And there is a nice composition of panelists, so everyone will touch different aspects of that. Me personally, I will be talking about the neuroscience of problematic pornography use, porn addiction, sex addiction. My background is in clinical psychology. I've been working as a clinician for years. I still work as a psychotherapist, but also my second degree was in cognitive neuroscience. And at some point, while I was working with people who had problems with sex addiction, porn addiction, I realized that we don't really have a good understanding how does it look like in the brain, what really happens. There was a lot of popular science analogies, but not real research. And organizations like World Health Organization or American Psychiatric Associations, they needed data to really see if it can be classified as an addiction, as a new disorder. Or not, and nobody was really providing this neuroscience data. So I decided to join my both fields of expertise, one in clinical psychology, working with patients who suffer from porn addiction, helping them, and another with this cognitive neuroscience field and understanding how does the brain works, how we can study it. And in 2013, I started working on this research project, which resulted with a lot of interesting findings on how porn is changing our brain activity, how we can reverse it in the process of therapy, what are the structural changes and differences in the brain of people who have problems with sex addiction, porn addiction, and people who have problems with other disorders like gambling, with problems with alcohol use disorder. And what are the similarities, what are the differences? So this is what I've been studying, and I will try to tell a little bit more how this knowledge can benefit clinical practice.
I remember seeing an amazing quote. I forget who it was by, and it said that porn is like taking heroin, but injecting it directly into the brain through the eyes.
Mm-hmm.
Does that resonate with you?
Yeah, it used to resonate with me a lot. However, what I did, it was checking, is it really like taking heroin or maybe a little bit different? Yeah. And we know that heroin is changing a lot in the brain. Yeah. And it also destroys, heroin impacts the ability to take pleasure from things. Yeah. And very often it's irreversible, yeah, because it affects it affects not only the motivational system but also this ultimate reward related system, which is related to opioids, endorphins, and so on. Yeah, and we know that in case of porn, the mechanisms are different. Yeah. So porn is probably a little bit more like a cocaine, not heroin. It affects more this motivational system, dopaminergic system. So we are losing motivation to initiate other activities, take pleasures from other things, but we don't lose the ability to really have pleasure from other things later on, once we get sober, once we are recovering. Yeah. And this is a very good thing. This is also something what we are finding in our brain research. Another thing is that we don't see this structural damage to the brain, which heroin is doing. Yeah?
Yeah.
And this is also a very good sign. However, we see very strong functional damage. Yeah. So the structure of the brain doesn't change, but the way how the brain is functioning, how it's, working, changes. And it changes in the same way as we see in alcohol use disorder, in alcohol addiction, in cocaine addiction, or in gambling addiction. And it's very persistent. It's difficult to reverse it, but it's possible to reverse it over months of treatment. And the good thing is that once we start this reversal process, the recovery process, we can come back to the life full of joy, because we can still, get pleasure from other activities. Yeah. Once we free up those resources of the orbitofrontal cortex, ventral striatum, or other structures related to motivation, then those new things we can rediscover in our lives are again a source of the great pleasure and joy. Yeah? And this is a good news.
That is an amazing news. And you're also talking to someone for whom this is resonating very strongly, because I'm in recovery for sex addiction. I've struggled with sex addiction for decades. I'm 53 years of age, and I have blighted a large part of my life because of my fascination and addiction to various forms of sexual activity, to mask the pain that I have been trying to live with and bury for many years. And so I'm living proof, I believe, that we can come to terms with what we've done and rediscover other joys. And I'm living a very different life today. I have my own opinions of how this could benefit sexual health. But if you could tell our audience, what do you think are the specific benefits to sexual health of your research and what you're doing?
Yeah, so first of all, what is important is that we, especially when I work with patients, one of the very important skill is to learn when do I really initiate sexual activities because of my sexual need, healthy sexual need, and when it serves other purposes like mood regulation, stress regulation, avoidance, coping strategies with difficulties in the life, and so on. Yeah, and this distinction is sometimes it's very difficult, especially at the beginning of the recovery. Yeah. But once people get more understanding of their needs, of their genuine needs, yeah, then it becomes more clear. And sometimes the total sexual abstinence is necessary for some people. Yeah. But what is also interesting, what we are finding in our brain research, that there is not everyone who suffers from sex addiction or porn addiction has the same patterns of changes in the brain. Yeah. There are at least 3 different subgroups. Yeah. Maybe if there will be a time during the panel, I will tell more about it. And for one of the subgroups, yeah, this, like initial abstinence probably is the most useful thing at the beginning. But there's another subgroup where the healthy sexual activity can be introduced much earlier in the healing process, in the recovery process. Yeah. And they can separate easier, those unhealthy sexual activities from the healthy sexual activities, and rediscover the joy of healthy sex pretty early in the process. Yeah. And the third group is a group which is also completely different from the others two. And it's more related to the cultural beliefs about sex, where, there's a lot of moral judgments around sexual activities. And this is also a completely different way of working with those people and helping those people. Yeah. And this is very important for me, when I looked at our neuroscience data, to understand it's very clearly, very visible. We can see that not everyone is the same, and there are different subgroups, and also the way to help those groups are different. Yeah. So this is interesting, and also sexual health has a different definition for each of those groups. Yeah. So everything is much more complex than it looks like at the beginning.
I'm sitting here feeling a massive wow. I'm wishing I'd met you many years ago. I think if I'd met someone like you, or you specifically, with the research and the knowledge that you have today, I might have had a much easier path through recovery. So I herald what you're doing. I'm relating to it very strongly. So thank you for what you're
And
doing.
thank you so
What?
much for telling that. And you know, the main drive for my work and inspiration for this work was, you know, this feeling of being powerless also as a therapist, as a psychotherapist at the beginning. Like, you know, when I started working with people suffering from sex addiction, porn addiction, you know, first of all, my supervisors couldn't really advise anything because there was very little knowledge on that. We didn't know how to work effectively. The second thing was experience of patients who really, you know, were trying 12-step programs, and for some of them it didn't work. Others were trying group therapy, didn't work for them. Years of individual therapy, and a lot of failures and trials, and a lot of suffering. Yeah. And then I just thought, like, okay, like, why don't we understand it better so we can really, you know, see what works for whom, because obviously there's no one golden bullet for everyone, and we need to really understand how does it work, what are those differences, how we can help and personalize this treatment. Yeah.
Oh, I want to give you a big hug right now. When I went through my first treatment center in 2004 for sex addiction, I was told just abstain from all these behaviors and they will slowly disappear and you will lose interest in them. I was like, really? How's that going to work? Of course I didn't. And I've had a bumpy road. So
Yeah.
to know that there is now science behind this to help people like me, to help people like me, through the work you're doing is wonderfully uplifting for me to know. So thank you. What, on the back of everything you've said, you've talked beautifully to how this can help patients. What would you, bearing in mind our conference is probably more aimed at the professionals, what would you like people to take away from what they hear you talking about on the panel?
Yeah, so first of all, during the panel, I want to show those neural mechanisms we can see. So it helps a lot to understand that actually not very often for those people who are the most treatment resistant, yeah, the bigger issue is not on the side of the sexual pleasure per se, and this, you know, they like this rewarding activity from which sex is obviously, but it's in this motivational system and the brain reactivity for all the cues, everything what is associated with sex. Yeah. What we saw in our studies is that, you know, at some point for this specific subgroup of sex addicts, the triggers becomes the biggest issue. And those are not only external triggers, but also internal triggers, like specific emotional states or situations we are in. Very often, you know, like people who suffer from this addiction, it takes them a little bit of time to identify those triggers, but then it becomes obvious that in certain situations it's almost, you know, 99-100%, you can be sure that sooner or later you will relapse. Yeah. And this role of the triggers is super important here. Yeah. So this is something what I want to show. Another thing I want to show is also our findings on the structural differences in the brain, which helps us understand the vulnerability for developing this addiction. Yeah. Not everyone is prone in the same extent to develop porn addiction. Yeah. We know that these days, also it's our most recent study, we showed that among 7 to 9 years old kids in Europe, 25% of them are watching porn on monthly basis. Yeah. So it's every fourth boy and girl, 7 to 9 years old. You know, those are small kids. Yeah. They are already watching porn. Yeah. And for some of them, it's super risky because they already have this neural vulnerability to develop very addictive behavior very soon. Yeah. By the age of 15, we already know that 10% of boys will be watching porn on daily basis, and it will be already, you know, probably addiction, yeah, or very destructive habit, yeah. And this is something, you know, how we can identify those vulnerabilities during the clinical interview without the scans, yeah, brain scans, like in the much more efficient way, yeah. That's the second thing I would like to share. The third message would be this differences between different subgroups, how we can identify them, how we can work with different subgroups, that not everyone is the same. There are visible differences. And the fourth one, it will be our most recent findings, how those neuronal changes are reversing during the successful few months long treatment. Yeah? Because this is a really like message full of hope that we can really see it in the fMRI scanner, that those changes are disappearing over time when the treatment is successful.
I feel full of hope just interviewing you for this casual conversation from the couch. I will absolutely be in the audience to see this live. And I don't want to spoil too much of what you have to say. I want people to come and hear this because I'm feeling into what you're saying. And I think it's so important for therapists in particular, so they can better help clients with them, empowered with a much better structure to how to address this insidious problem.
Mm-hmm.
So thank you so much for talking to me today.
Thank
One last little question.
Yes.
Sorry?
No, sorry for interruption. I think there was a problem of connection. Yeah, but thank you for having me here, and thank you for giving, you know, this chance to share this message.
Is an amazing, as you said, as you just said just now, Mateusz, it is a massive message of hope, and I'm thrilled to hear what you're talking about. It's fascinating me.
Mm-hmm.
One quick question, one more for you. Is there anything you would like to tell people of where they could catch you, see you, anything in particular of any note that you're doing before the conference or even later this year?
Sure. So at any time, you can contact me through the website, Dr. Dr. Gola.online. So it's DRGOLA .online. And you can find all the papers we published recently and in the past years. You can also contact with me and either through email or through the form there on the website. And whatever questions you have, I'll be happy to answer them. And yeah, that's my purpose in life, to learn more about this problem and provide the answers for really important questions here, and guide the new wave of more effective treatments.
Mateusz, your sincerity and your authenticity in this subject matter is spellbinding to me. Thank you so much. I cannot wait to meet you in person in Seattle. And for now,
Yeah.
just a massive thank you for your precious time today.
Thank you, Mark. Thank you so much. It was great to meet you as well. And I'm really looking forward to have this real life meeting, not another online meeting.
Oh.
However, you know, whenever you or anyone who is watching us or would like to contact online, then I'm also available.
Thank you.
Thank
Fantastic. Take great care. I'll see you in Seattle.
you. Yeah, see you in Seattle.
Bye for now.